The assessment being described in this presentation is the Receptive Expressive Emergent Language Assessment. For the purposes of this video, we will refer to it as the REEL-3 assessment. This will be voiced and presented by Courtney Hale and Madeline Richmond. The purposes of the REEL-3 assessment can be categorized by its three subtests: the receptive language, the expressive language, and the inventory of vocabulary portions. This assessment is designed to help identify infants and toddlers who have specific language impairments or other disabilities that affect language development. The REEL-3 assessment only measures the language development of a small percentage of the population. It is designed for the age range of birth to 3 years of age. When calculating the age, to check if this assessment is appropriate for the client, you must adjust for prematurity. It identifies those who may have disabilities, conditions, impairments that affect language development. This is a great assessment and planning tool for early childhood intervention programs. This assessment is a norm reference test. The normative sample used to create the assessment scoring criteria includes 1,112 infants and toddlers from around the United States. The authors of this assessment are Kenneth R. Bosch, Richard League, and Virginia Brown. The REEL-3 assessment was published in 2003 through the ProEd publications. The REEL-3 assessment has a minimum testing time of 20 to 30 minutes. However, there is no time limit on how long the assessment may take an individual to complete. This is the combined time for the two main subtests of the REEL-3, the receptive and expressive language portions, respectively. Like mentioned previously, it is a norm reference test. There are three score criteria: raw score, standard score, and percentile ranks. The assessment is divided into subsections based on age: 0 to 6 months, 7 to 12 months, 13 to 18 months, 19 to 24 months, and 25 to 36 months. The complete REEL-3 assessment kit includes the examiner's manual and 25 profile examiner record booklets. The tasks required for this assessment are quite simple and straightforward. A series of yes or no questions will be asked to the informant concerning their child's development. This informant is typically the most knowledgeable individual about the child's language behavior. Informants are, but not limited to, parents, guardians, or child care providers. An example of some of the questions asked to the informant on the REEL-3 include the following. For infants 0 to 6 months of age, an expressive question may look like, when hearing voices, does your baby ever vocalize back? While a receptive question would be, does your baby definitely turn both her or his head and eyes toward a nearby speaker?
For infants 7 to 12 months of age, an expressive question may be, if your baby doesn't use real words, does she or he sometimes seem to talk in complete sentences or phrases? While a receptive question may be, when you mention the name of a family who isn't in the room with you, does your baby react to show that she or he knows who you're talking about? For infants and toddlers 13 to 18 months of age, expressive questions may be questions like, do you sometimes hear real words while your toddler is talking? While a receptive question could be, when someone talks to your toddler, even for a long time, does your toddler listen and seem interested? For toddlers 19 to 24 months of age, an expressive question may be, does your toddler label or have names for all her or his toys, food, pets, or other objects? While the receptive questions include questions like, when someone says major body parts such as hands, legs, feet, and nose, does your toddler point to these on her or his own body? For toddlers 25 to 36 months of age, expressive questions include, does your child tell you that she or he needs help with personal needs such as getting a drink, washing hands, or going to the toilet? While receptive questions include, does your child point to smaller body parts when asked? For example, her or his chin, eyebrow, belly button, toe. This assessment includes a raw score that is calculated by the number of yes responses the informant gives. This raw score can be converted into standard scores and percentile ranks. Scoring also includes the composite ability score, also known as the language ability score. This is the best measure of language skill development for comparison with chronological age. When this score is below 9, examiners should pay particular attention to the child's performance of the two subtests.
Interpreting the composite language ability score is positively correlated between the score and developmental level. A child scoring high in this section indicates that the infant is developmentally on target in both receptive and expressive language. And on the other side, a toddler scoring low in this section indicates that they may have congenital delays, deafness, physical anomalies, or other medical conditions that may affect speech acquisition. Through interpreting the receptive language subtest, one can be concerned that the child has a hearing impairment if they score low in this section. Low scores in the expressive language subtest denote the need for the child to obtain further assessment to determine eligibility for developmental delay diagnosis caused by some sort of comorbid condition. The vocabulary inventory section is a new and supplementary part of the REEL-3 test. It provides the informant with the opportunity to report specific words that are characteristic of their infant's developing language during an informant or caregiver interview.
This curriculum is especially useful in early childhood intervention programs. These programs are mandated under the Public Law 99457. This is the public law that regards the Education of the Handicapped Act amendments. These amendments reauthorize the Education of the Handicapped Act, EHA, and include rigorous national agenda pertaining to more and better services to young special needs children and their families. It is important that interpreters are provided if the child does not use English as their first language in the home. This exam can be administered by anyone with basic knowledge of the test. This test includes basals and ceilings and adjusts the chronological age for prematurity. The REEL-3 has many strengths. The results of this exam can be used for clinical intervention. It is especially helpful as it allows clinicians to view each subtest separately. This allows for a clearer picture of an infant's strengths and weaknesses. This exam has also been carefully designed as it has been through 2 prior formats. This test also has an extremely thorough and representative population. While the REEL-3 has many strengths, it also contains room for error. For instance, this test is prone to the subjective nature of the informants. Caregivers can give their children too much or not enough credit. This exam also leaves no room for variability. The informant must answer only yes or no. There are no in-between options such as frequently, sometimes, or infrequently. The following slides contain our references. Thank you for learning about the REEL-3.